Okay. A special good morning to the members of the Sacred Heart community. At this time, we will begin the discussion, a very important topic on cancer awareness. This is being led by the Women in Ministry. You've heard about this ministry, which have just commenced in the month of October. We have a very special speaker who will lead our very first presentation, and that is Miss Mary, Dr. Mary Radix. It takes me great pleasure and is an honor to welcome her to the podium to discuss a topic that is very daring to all of us. In every household, in every family unit, we will have suffered or been impacted by the news of a loved one suffering from cancer. In fact, as you know, September is the month recognized for cancer, and October particularly for breast cancer awareness. And today it gave us again great pleasure to introduce our guest speaker, who will raise our awareness within this community on this topic. Thank you very much, Dr. Radix.
Thank you, Tracy, and I'd like to thank the Women's Ministry for asking me to give this first talk. I feel very honored and a little intimidated because I am the first, but maybe that's not the bad thing, because then I don't have the difficulty of following on from previous great talks. So I'm actually a general practitioner, and so the idea is that this is going to be what I hope is a different kind of talk. To me, it's more like a nuts and bolts kind of cancer talk. So hopefully I've tried to simplify it so that everybody will be able to understand it, and afterwards just feel free to ask questions. Right. So we're going to talk about cancer today. Right. And then the definition of cancer. And this is a whole busy screen, but basically cancer is actually a group of diseases, but it's characterized by two things. There's uncontrolled cell division, and there's an overproduction of cell multiplication. And that is where the problem lies, because you just get this uncontrolled overproduction and they take over everything. It's like an invading army come in and just take over the country. And when it takes over anything, unfortunately, then it can lead to death, right? So it basically, the slide will show and this is simplified, of course, because that's what I'm saying. You have normal cells, and then you have cancer cells, right? And then this is a cell that shows what's actually, the cancer is also called a tumor. It shows basically, because you saw what the normal pattern looked like, inside the tumor cell there are a whole lot of other things going on, a whole lot of cells around. It's swollen. There are also increased blood cells. There are the cancer cells. All sorts of things going on, as you can realize it, right? The immune cells, molecules, blood vessels. It's called the tumor microenvironment. This is what it lives. Its environment, where it lives. Okay, so we said, and this is what I want you to get, that cancer it's basically a disorder of the genes. It's a genetic disorder. You know that the body is composed of millions of cells. So this is a simplified version of the cell. You have a cell, and the brain of the cell, or the center living part of the cell, is called the nucleus. In the nucleus is your genetic matter. They're formed chromosomes. I'm sure everybody has heard the chromosomes. If you unravel the chromosomes, then what you have are these strands of DNA, and which are basically like little links of proteins linked together, and specific areas on the DNA are known as genes, right? I think everybody knows about the genes. That's where you inherit your good looks from your mother and your height from your father and all those other kind of things. Well, that is also involved in the pathogenesis of cancer. Right. So basically what happens is there's a change in the DNA, and the change in the DNA then causes the gene to move from a normal gene to one that's called an oncogene. And you learned a big word today, but basically it's a gene that can code for cancer. So that's it. The DNA changes the genes in normal cell growth, and they become oncogenes. Now, normally in the body, cells multiply and divide all the time, which is why when you cut your hair, if you don't like it, you can always say, well, you know, in a couple of months my hair will grow back, because cells are doing it. However, you know that when it gets a particular length, it will stop growing. That's your norm. So cells in the body do grow and multiply, but the normal cells, when they get to a point, they stop growing. With cancer, they don't. Remember I said overproduction and just uncontrolled growth. Right. So basically, your body has, God does divides a number of safeguards there. So we have a normal cell, and in the normal cell, we have a normal DNA. We have genes that are known as tumor suppressor genes. These are the genes that are supposed to turn off the growth, so that when a cell starts to grow, these genes are supposed to turn off the growth pattern. But unfortunately, what happens is when you have a cancer cell, what the cancer cell can do is that they can inactivate the tumor suppressor cells. So these are like the guardians, and then the cancer cells come along and they immobilize them. They put them out of business, so to speak. And once the tumor suppressor cells are put out of business, then the cancer can say, okay, boys, let's take over. Right. So you also have your immune system in your body is also supposed to help to detect and attack the cancer cells. But we have learned that some of the cancer cells actually seem to be pretty smart, and they do different things so that they can avoid detection by the immune system. But scientists have been able to turn some of that around, and they've actually been able in some cancer treatments to use the immune system to help detect and kill the cancer cells. We'll talk about that a little later. Right. So basically, as we said, it's a problem in the genes, but this is a key and important, well, it's one of the key and important. Everybody's cancer has a unique combination of genetic changes. Specific genetic changes may make a person's cancer more or less likely to respond to certain therapies. And this is seen, because I'm sure you would know, that there are some people who have had breast cancer, for example, and you might know 3 people who have had breast cancer, and they undergo the same treatment. And 2 out of the 3 do well. They go through the surgery, they go through the chemotherapy, the radiation therapy, and they do well. And their breast cancer goes away, they go into remission, it doesn't come back. And then there are people who go through, do the same things, everything, and their tumor does not go away. And that is one of the reasons why, because everybody's DNA is unique. So when people keep on, when are they going to find a cure for cancer? It's not that simple, because so what Jane W's breast cancer is, it's not what's going to be Karen P's breast cancer. Everybody's own is unique. Right. So, what are the things that are thought to be implicated in having these genes go a little crazy? So we know that hereditary does play a factor, because I'm sure that you're aware that there are some families in which cancer seems to, quote unquote, run in families, right? And two of the biggest ones that we have in Barbados are prostate and breast cancer. And yes, they do tend to, quote unquote, run in families. This is also unique in that, no, I think I'll leave that to later on. Right, then there's UV radiation, which we get from the sun. We know sun is a wonderful thing. We like it. It helps our grass grow, our trees grow. But basically, that too much exposure to radiation can actually promote cancer, especially the skin cancers. And this is one thing I want to say is that, you know, you're all familiar with the tourists coming and they're using sunblock. And we think, oh, we live here and we're black and our pigment protects us. I have a nephew who's a dermatologist and he says, no, we're supposed to use the sunblock the same way. And one of my earliest memories of watching cricket, there was this international cricket umpire, Lloyd Barker, out of Jamaica, and he would be there with his big floppy hat and he's covered all up, and then you would just see his white nose. It wasn't, because he recognized he wore the big floppy hat to protect himself from the sun, but his nose was sticking out, so he'd have the sunblock there. So, okay, so then we have chemicals, and they're all different chemicals, and I'm sure that you all know some chemicals where there are concerns that these can actually cause cancer. We know, like the asbestos roofs, people are concerned about that. There are things like smoke. People who work in certain industries, like leather industries, people who are like the coal miners and they work in mine, those chemicals are what we call carcinogenic. They can cause the genes to change and you will develop cancer. There's also the viruses, and probably one of the best known is what we call HPV, human papilloma virus. There are many different HPVs, but certain group of them have been found to cause cancer of the cervix, right? So actually, that's one of the changes that we look for when we do the pap smears and we're looking. You can actually sometimes detect the presence of the HPV virus. I wanted to say something about that, but yeah, it'll come back. Right, yeah, and so HPV, there's also the Epstein-Barr virus, which cause infectious mononucleosis, supposedly the kissing disease. Yeah, it can cause, not everybody who gets it, again, as I said, emphasizing a difference in people's DNA. Most people get infectious what they call infectious mono, and it just goes away. But in some people it can persist, and in some cases it actually can cause cancer. Right? There's also another one called HTLV1. In addition to viruses, there are also some bacteria, and I want to make mention of H. pylori. Helicobacter pylori bacteria, which is found in the stomach. Now, in our population, over 90% of our population, if you tested for that, you would find it in people's blood, right? But obviously, even if it's a 90% of us are not coming down with cancer. This is again emphasizing that everybody is unique. So the vast majority of people have H. pylori. It doesn't affect them. Actually, doctors will sometimes do the test, and then they see it and they treat it. That's not the approved method. We usually only treat it if we find it and the person is having symptoms. But I guess some doctors want to take the safe route, so they decide to do that. And then, of course, is the one which everybody knows, smoking. Yes, and you know not only about that the person who smokes can get their lung cancer, but if you happen to be around them and you get the so-called secondhand smoke, very bad. I used to be in a book club with people, and probably about 12 and 11 people in that group smoked. And I was the only one. Every time I'd be trying to move my chair around. And one of my friends, actually, how she announced she had given up smoking, she walked into the group and she says, "I'm sitting with Mary today." So there you go. Right. And then there are, for unknown reasons, that the gene undergoes a change, what we call a mutation, and then you get the uncontrolled dividing of the cells. Right, so you may notice that relatively few younger people tend to get cancer. It's not that it's not present in young people, because of course you have children who die of cancer, you have teenagers, people in their 20s, but the incidence gets worse as you get older, because they think that basically that the cancer-causing genes, they tend to accumulate, in this case not rapidly, but they tend to accumulate as a person ages, so that as a person ages, then they have a higher risk of cancer later in life. Right, okay, so cancer, we kind of did that, yeah. Right, so, and then one of the fundamentals of the cancer is that cancer spreads. So you have it initially and it's localized in one area, and then the tumor cells tend to spread out and involve the tissues that are nearby. And then the final stage is that they travel. They get a visa and they go places. So they move from where they are originally and they travel either by the bloodstream or by your lymphatics, and they end up in places. Common sites would be places like the lung, the liver, the brain. Those would be some of the common sites. And for prostate cancer, the spine, they travel to bone. Right, so this is another just representation. Cancer spreads to other parts of the body. Now you can have a tumor which multiplies, and you would, that's actually what we call benign. So say for example, a fibroid, which everybody knows, that actually is a tumor, but it is not a cancer because it does not spread, it stays in its spot. The growth is, yes, it does, it's a bit out of control, but after a while it does stop and it doesn't take over like other people, like other things do. Right, so we're going to talk a bit about the treatments, and these are the different treatment options that you have. The most common, we'll talk first, is surgery, and you will know people who, after having been told that they have a diagnosis, they will say, okay, the doctor has recommended that we're going to have surgery. So that's probably the most common. Then you would have basically chemotherapy, which everybody is aware of, that basically you usually get some medication. The medication, you usually get it by a drip, or you might take it by mouth. Some cases, the tumor itself might be directly injected with the medication. That's also chemotherapy. Then there's radiation therapy, which you would know. You use high frequency rays, and it's that hones in on the cancer and is supposed to kill the tumor cells. Then there's immunotherapy, which I mentioned, where they use special drugs which kind of activate the body's immune system to go after the cancer. They're hormone therapies, because there's certain hormones that can do that, and in the breast cancer and prostate cancer, those hormone therapy is one of those. There's also that's targeted therapy, which again is one that's supposed to go straight for the tumor, and it's supposed to spare the other normal cells of the body. And then in certain blood cancers, there's bone marrow transplantation, because the bone marrow in the center of the bone has been infiltrated by the tumor. So they literally get in there, they scrape it out, and they take healthy bone marrow from donor who's compatible, and they replace it. Right, okay, so this just goes through. We can skip because we talked about those. Right, so I could not do this. That was where the talk was supposed to end. But then I said, no, I have to give people I have to give a Barbadian perspective. And the Barbadian perspective, I would say, at present, is a bit on the discouraging side. We have our 5 main cancers are prostate cancer, breast cancer, colon cancer, uterine cancer, and cancer of the pancreas. Now, in Barbados, we just started a cancer registry, I think in 2018, where they're trying to get the data on the cancer incidence and treatment and mortality of cancer. But it's very difficult for different reasons, because doctors are supposed to report, but sometimes they don't report. Sometimes somebody gets a diagnosis and they're told they have cancer and they die from the cancer, but somebody puts like heart failure on the death certificate, and that really is actually a cancer death. So this, ironically, is the first and the last so far. This paper was actually published in 2020, make sure I have this right, 2023, but as you can see, it only covers the data from 2013 to 2018. So it's a 5-year study, but it's the first, so this is what everybody refers to. But pretty much, as you can see, that the 5 main cancers actually the first 4, those are the ones that have been the leading cancers all along: prostate, breast, colon, and uterine. Pancreatic cancer, even though it was a contender, you would see that in 2013 it only ranked 9th, but that it actually moved up to 5th, right? So the most common cancers in Barbados is prostate cancer, then after that it's breast cancer, and our indications are that those numbers actually 2023, that the numbers are actually higher. So the incidence is actually increasing, which is a little depressing, but it is. In the good news column, because I like to find good news, is it does appear that our incidence of cervical cancer is on the decline. That's definitely on the decline, and we think that this is a triumph because of our detection through pap smear. So yes, you should get your pap smear done. Right, okay, so just to give you a little bit of perspective and why I say it's a little depressing, in terms of percentage of deaths, worldwide, Barbados is number 2. Barbados is number 2. So we do have a problem. In terms of breast cancer, our world rank is 5th in the entire world. Also, when it comes to colorectal cancers, we're also 5th. Pancreatic, as I said, uterine, we also, I think, at 5th. And then these are the WHO figures, which I think are 2019. So again, we're not really up to date. These are the lists. So in terms of pancreatic cancer, yes, our numbers are still relatively small, so we don't have, our world ranking for this one. Yeah, we're all the way down. But the discouraging news is that even though the numbers are relatively low, the numbers have increased. Right. So, we always have to end on a good note. So after that depressing news, we had to find that. So this is, I think, from American Cancer Research Institute, that 50% of the most common cancers can be prevented. So that's the good news. So it's not that you're just sitting down waiting for the bolt of blue to come hit you, and you're going to develop cancer as you get older. 50% can be prevented. So we are going to just, on our last slide, basically talk about the things. I mean, some of them are commonsensical. We know about smoking, for example, so we're going to do that. There's also alcohol. I'm sorry, but I forgot to mention alcohol when I was talking about chemicals. Don't know why, because but we have a really big problem with that. So don't smoke, don't drink alcohol. You want to limit your consumption of red and processed meats. About 10 years ago, I read something that the American Cancer Society said that red meat was the #1 carcinogen. And I immediately lost my appetite for, I never was big on beef or anything, but it got even, and processed meat. So the salami and the ham and the other processed meats, those are sought to be aware of them. You want to limit your consumption of fast foods and other processed meats that are high in all the things that make food taste good: fat, starches, and sugars. We know that breastfeeding imparts protection against cancer of the breast. So yes, you encourage your mothers to breastfeed. Now somebody's going to say, but I know somebody who breastfed and they still developed cancer. One of my very good friends, her children never had a drop of formula. She was the example that I tried to emulate. So it was very disheartening when she came down with it, but she did have a family history. But the good news is she got her treatments done, and then she's great now. Right, then if you get a diagnosis, you follow up with the doctor's recommendations, right? Exercise, everything for your good health. Eat right, diet rich in whole grains, vegetables, fruits, and beans, yes. And the exercise, yes, so we can exercise, right? Here, basically, they tell you don't use supplements for cancer prevention. And the reason and the rationale behind that is some people use the supplements as a alternative to eating healthy. People come and ask me, Dr. Radix, what vitamins do you take? And I kind of say, vitamins in my definition, for most people, it's like saying that you need to eat food and somebody tells you, okay, I'm going to give you salt and pepper. Yeah, so yes, sprinkle on a little bit, but there's no substitute here for eating right. Okay, and I think that brings us to the end. Little cartoon. Cell phones pose a cancer risk. Computers may lead to identity theft. Paper memos kill trees. So why do anything? But I think hopefully you can counter that. So thank you very much for your attention. Anybody has any questions, I'll do my best to answer. Okay, Dawn? Uh-huh. Okay, yeah. Okay, so the question is about mammograms and whether some people think that the radiation in mammograms could be bad and quote-unquote lead to cancer. Now, everything, they used to say everything in moderation, but too much of anything is good for you. This mammograms have been around for, I think, I don't want to say exactly how long. But what I'm saying is that the amount of radiation that you get from a mammogram, where's Shildevan? Right up here, will tell you. So very, very low. And it's also very targeted to get to your breasts, and they put your head out of the way and your neck out of the way, all to reduce the incidence of that. So I don't, honestly, I have no problem with getting my mammogram. And I also have a family history. Actually, I'm a little more concerned about when I go to the dentist and they do this, because they many times don't take any precautions. And one of the things that dental x-rays have been associated with is thyroid cancers, because they don't protect your neck. When I go to have my mammogram, my radiographer is wonderful. She makes sure that I get my head out of the way, my neck out of the way, and they concentrate on my breast. Right, and Sylvan will say something else. Any radiation, yeah. Yeah. Because remember, you walk out in the sun and you are exposed to ultraviolet rays. But when you walk out in the sun, you don't think, oh, I'm going to probably get cancer from the sun. You recognize that basically you're out there for a short amount of time, that you're also exposed to relatively small amounts. So wish to tell you that there's no risk at all, but unfortunately can't. But I would say, given the large numbers of people who have it, the importance in helping in early detection, you have to weigh the risk and the balances. And as I said, I have relatives who won't, but I have no problem with it. Right. Yeah, Janice? Okay, I didn't address it. I didn't really. Oh, sorry. Yes, right. So the question was about the use of marijuana in the treatment of breast cancer, and I be honest, I didn't actually do it. So the knowledge that I have is what we call anecdotal, from people who have used it and found it to be beneficial. And I know that in the states where medical cannabis is legal, it can be used in the treatment of the cancer pain. But it's in management, it's primarily in pain management. No, I think it's the oil. It's a cannabis oil. It's the distilled oil. That's yeah. So you heard that Barbados is developing a cannabis industry. Yes. So it's the oil. It's the oil that's used. Yeah, and people do different things. I think some people smell it. Some people take it in. Some people rub it on. That, but it's not my area. So as I said, just anecdotal. Yes, Lucy. That is what we seem to be finding out, that it's HPV, that it is. Yes. Yes. The question was about whether HPV was the only causative agent. Sorry? Sorry, Siobhan, you want to say something? Yeah, well, you remember that I said, right, that even though viruses are implicated, there are changes which can undergo spontaneous mutation, right? But I'm not too sure about when you said about the relative being 99. We did say that the incidence of cancers increase. I myself had a patient who, and it haunts me, came and she was losing weight. And she was really advanced in age. So I did all the screens for all the other more common causes of cancer. And because I guess I was biased because of her age. And all the tests that I did came back. And then a little light bulb went off in my head. Mary, you didn't check this lady for, when it had a pap smear, be about 30 years ago. And I did the vaginal exam. And as I did the vaginal exam, I hit a rock hard mass. And I knew I had found the cause of the cancer. Cautionary tale. So you don't exclude people. You say, okay, we have ideas that certain cancers are found more commonly in this age group, but the fact of the matter is this can be found in any age group. But as far as we know, for now, the HPV is the one that's implicated in it, yeah. Which is why we also have the vaccine. Sorry, I forgot to mention that in prevention, the vaccines for HPV, yes, those are, that's important, yeah.
No, I vaguely remember, it's just a comment which you can confirm or, but I'm trying to remember why it was connected. This could have been probably a decade ago, because I remember growing up and hearing that I think it was cervical cancer. And it said, like they thought it was connected to females who had multiple partners. Was it that?
Right, yeah, because you see, at the beginning, and certainly when I was in medical school, which dates me, they used to have different causative effects. They would say basically that the cancer of the cervix was virtually unheard of in nuns. And then there were people who were, let's say for lack of a better word, had multiple partners. But then basically they just thought it was related to sex, no sex. But actually found that the people who had multiple partners, because they had multiple partners, they were more prone to an HPV infection. Juliet? Okay, so that is a very valid question. The question was that when you do the mammogram, some women have very dense breasts. And for those who might not appreciate what it means to be dense, remember that you're basically looking at a picture, right? Because when you're doing your x-rays, they're based on a picture. So it's the difference between if you were looking out the window and you had clear glass. And then if you had frosty glass, you wouldn't be able to see all the details there, all right? So basically, and just within recent years, they have actually asked, I think it started with the American Cancer Society, they've actually asked the radiologists, when they're reporting on the mammograms, to make some note about the breast density. And then, depending on the breast density, if they think that this may affect it, then there are different things that you could do. You can do, there's now the 3D mammogram, the ultrasound. You can also do now the CAT scans. There's an MRI of the breast as well. So these would be additional tests to augment that. And of course, the golden rule is, if you find a lump, that negates a negative mammogram or ultrasound. My very dear friend, breastfeeding friend, she found a lump. She had a negative ultrasound and a negative mammogram. Yeah. Okay, go ahead. Yeah. Mm-hmm. Um, well, yeah, sorry, the question, right, is that she knows somebody who was having a pap smear done every year, and they had a pap smear, they were having a pap smear every year, but they actually were found to have cervical cancer, and unfortunately, the person died. I would like to say that, no, I honestly would not discount it, because I've personal knowledge of one lady who had a normal pap smear 1 year, and it was reported as normal, and then when she had the one the following year, it was reported as abnormal. There's several things for that. When you do the pap smear, you are doing a sample. And as you know, sometimes when you're sampling, you could actually miss the spot, you know. Now we do the liquid-based ones where you do the swab, and then you take the brush and you put it into the liquid and you send it off to the lab and they look under it. Before, we used to do the slide one where they used to just take the smear, put it on, fix it. But as I said, it's sampling. So it is possible that you could actually miss an area when you sample, you know. But what I have found, for the most part, this would be what we'd call anecdotal. It would not be the norm, but certainly it could happen. Yeah. Right. Shalon, you wanted to say something? You want to come up? Yeah. This is a resident radio.
And you can correct me if I say anything incorrectly, right? No, basically, Juliet had asked about the density of the breast. Like if someone has a very dense breast. Yes, it's usually how to say? It's usually an issue, if I want to use that word, for want of a better word, where the mammogram is concerned. So this is why, following both the UK and the American guidelines, they had stipulated that from age 40 is the baseline that all females need to start having their mammogram. Mostly from that age, anything younger, the breast tissue tends to be pretty dense, and it's a bit difficult to pick up certain things in the breast. Now, what we've had happening is, decades ago, following up on the breast cancer issue, they found that it was mainly the older women who were coming down with breast cancer. The tables have turned a bit with that. It's not just the older women. In my time, and this is up to like 15 years ago, we started with 25-year-olds coming down with breast cancer. So now we have to be more vigilant. So what happens is, even if they're young and they present with something, because I had a lady up to last week, she was very young, had no family history of breast cancer, none of her relatives, and she had a huge lump. So once they present with something like that, the mammogram is used most times as the first order of the day to follow up. Why? Because with the mammogram, you can directly see the image. Most times, the lump should be showing up on the mammogram. If it's not showing up there, depending on the density of the breast, they may follow up with what you call an ultrasound. And then they do other tests, as Dr. Radix had said. But yes, the tables are turning, and as she mentioned as well with the breast cancer, what we have found is probably it's genetic as well, as she said, because we found some people get it today. Okay, you present with a lump today. I had a lady, I think we picked up in November. And no, we didn't pick it up in November. She came, had her mammogram. It was clear, we didn't see anything. By February, she had a huge lump. And it was growing, it was very aggressive. Now, as she said, it is genetic, it depends on the individual. With some persons, it might not grow as fast, with others, it grows very quickly. So it's something, and your self-exam is quite important to always try to check your breast. Some people show up to their doctors and say, well, I've felt a lump, you know. So you try to check, you're in the shower, and you check going around the breast like this, all up under the arm, to see if you feel anything out of the ordinary. But as you get older, the breast tissue does change, as you'll realize. It's more fatty, so we can pick up things faster on the older breasts than on the younger ones. Basically, that's all I can say.
Thank you, Shilda. Practical experience. Yeah. And just as an aside, the recommendation used to be that if you had a first-degree family history, a sister or a mother who had breast cancer, you should have your mammogram done 10 years before. So that would have put the person whose mother was at 40, that you have it at 30. Well, my mother came down with breast cancer at age 80. So I wasn't waiting till I did have my first at 40 though. Yeah. But sorry, I did really forget to mention that. But the self-examination and the self-awareness too. And I know in some cases, and I say this as a doctor for nearly 40 years, the fear is real. So women find lumps and they do nothing because they're afraid. Cautionary tale again, I remember a lady came to me because she hurt her knee. And I don't know why, I looked at her and I said, okay, go and take off your clothes. You know, you can leave on your panties, but if you take off your bra, I will examine your breast as well. Because she was about 60. And I went into the examination room and I saw that she still had her bra on. And I said to her, there, but didn't I mention to you if you took off your bra, I would examine your breast? She took off the bra and I saw something about the size of a golf ball in her right breast. And I like to think that God caused me to be asked for that and for me to actually go the extra mile, because what she came and she complained with, I didn't even have to put her on the couch because I think she hurt her knee. But, yeah. So unfortunately, she had to refer her to the hospital, and basically everybody was saying, why did you wait so long? But the fear is real, and I'm a doctor, and I'll tell you that the prospect of cancer does frighten me. But that's the reason why I'm here to give the talk, to tell you that early detection can make a real difference. Sandra? Yes. Yeah, breast, actually that used to be one of our, or Sandra asked if metastases of the breast, where is there specific areas that they can go to? And yes, they can go to the brain, they can go to the lung, they can go to the liver, and they can go to bone. Those are the common sites. Right. So as I said, 50% of the common ones are preventable. So hopefully what you heard today means that what you've heard, that you do all the things that you can do to minimize your risk. Oh, and I forgot, I did mean to talk about this, I've just remembered it. I was talking about, I forgot to mention the genetic testing, because it can actually now do the testing for certain genes well, probably one of the most well-known is the BRCA gene. Angelina Jolie had a double mastectomy because her mom died of breast cancer, and she did the genetic testing and found out that she had a risk, and she wasn't waiting to develop it. She had a double mastectomy. Controversial, but I guess she doesn't have to worry about breast cancer. Yes. Right, so anyway, hopefully, yes, we'll be able to talk to somebody, a relative, or maybe a friend who confides in you, because, as I say, fear is a paralyzing thing, and the fear that it could be something might prevent you from doing something, but you can't do something about it if you don't know what you're dealing with. It might very well not be. Right? There are benign lumps in the breast, but you make sure that if there is a lump, that nothing stops until you get the confirmation that it is a benign lump. So, thank you very much.
Good morning again. I'm here to thank Dr. Radix for her very informative talk. I don't know about y'all, but I learned a lot that I thought I knew but really did not know. Very informative. I guess everyone here was impacted by it at some time. I lost an uncle only last year, December, Christmas Eve to be exact, to cancer, so it impacts all of us. We might know a friend, a co-worker, somebody with it. Very, very informative, Dr. Radix, and thank you very much. And on behalf of the Women Ministry and Father Moses, we want to say thank you for your talk. Hope it will not be the last.
Thank you very much. Thank you very much. Thank you for inviting me. I was honored because I was the first.
Oh, and on a side note, there is a small treat out there, snow cones for you all. After, I know here it's pretty hot, so there is the build your own snow cone. Actually, it's right out there on the lawn when you leave here. Thank you.
Ask Dr. Radix if it's possible. It might not be possible, but I was still asking if you can put together a brief, small little brochure, like, let's say brochure,
Yeah.
and your little presentation.
Okay. Well, it's a PowerPoint presentation, so I have no problem with sharing it if you want to, because I tried to make it simple without the big words and the things, so that everybody could do that. And it's streamed on YouTube. Yes, so if you want, there you can. Yes, on YouTube. Right. Yeah. So that's actually do. But if anybody'd like to actually have the actual PowerPoint presentation, by all means, just let me know, and it's there for you. All right. Thank you.